Well, Manx Care. It's all happening now. We've had Teresa Cope, CEO of Manx Care, finally take the hint and resign. Finally she's done the right thing. But what gets me is how on earth the Isle of Man government allowed her to stay in that position for so long and do so much damage. And I personally don't think it should have come to the case where she resigned. She should have been sacked years ago. And I know some MHKs will say, well, we had COVID, blah, blah, blah. But from my recollection, I believe they were sort of transitioning into takeover nobles on the sort of downward spiral of COVID, from what I remember. And I'm saying that because I worked at Nobles Hospital during COVID, and I wasn't working for Manx Care when I started. So I was brought in because of COVID. And I remember it wasn't Manx Care then. My contract and my ID did not say Manx Care. It said Department of Health and Social Care. And then, unfortunately, I decided, it's a hard job. It is a hard job working at the hospital for very low pay. Don't get me wrong though, I loved it. I loved working at Nobles. I felt like it was like a second home. It was like a family. I loved going to work there. I had many friends there and still do have many friends there. And I really actually miss working there. But unfortunately, there are some bad eggs there. Now, before Manx Care took over, I would have said there was very few bad eggs there. But unfortunately, since Manx Care took over, they have taken on more people that shouldn't be in positions and kept them there, because Teresa Cope is a bully and she likes bullies. That's her type. She likes people who get things done regardless of whether it's legal, within employment law I'm talking, regardless of whether human resources would frown upon it. But it's all swept under the carpet, so nothing ever happens. And what happens is people leave. I'll never ever forget the manager that decided to take a personal vendetta against me when I was there. I didn't give a toss. I was, in hindsight, I do now, but at the time I thought, sod this, I don't get paid enough anyway. That was my attitude. This is a hard job, I don't get paid enough. And now I'm getting abuse off some jumped up manager who's on a power trip. So I basically got out of there. And I regret that. I should have fought it. And I should have made sure she was disciplined and dismissed from her position, because it was only, 6 months later maybe, that there was, and again I have to be careful what I say now with this one, but there was another staff member who had been there for years, who absolutely loved their job. And I'll never forget, it's the saddest thing, I wasn't working there anymore. I was there for an appointment, and I was walking down the corridor, and I happened to see this particular staff member in tears. And I couldn't help myself. I was like, oh my God, what's wrong? And I thought they were sick or in pain, to be honest. And they told me, they said, I just can't take it anymore. I can't take the bullying anymore from the same manager who bullied me. And I was actually trying to get them to sort of, take the right steps that I never took. I did do the wrong thing, I just left. But they'd been there for years, it was different for them. And they said, no, Kevin, I can't cope. I'm going home every night in tears. I'm depressed. I hate coming to work now. I used to love coming to my job. And they left. And that particular manager is still there. And I've since found out that there's so many people that manager has bullied. And Teresa Cope, funnily enough, when I met with Teresa Cope at the time, I already had a bad feeling about her. But then she's basically seen what I put on Facebook. And she reached out to me and said, well, do you want a meeting with me? And you know what? I thought to myself, wow, okay, she might change my mind here. She's actually offering to meet with her. So she thinks, wow, I was shocked. And I thought, maybe she's not as bad as I thought. And I met with her and I discussed a lot of problems with her. Not my problems. I went in there with other people's problems. But at the end of the meeting, I did mention to her, because she actually said to me, why are you not working here anymore? And I kind of laughed and said, well, for the same reason, I was also bullied and, treated badly by my line manager. And Teresa Cope said, did you ever put a complaint in about it? And I said, what's the point? Nothing ever happens. And she said, no, not at all. She said, if you want to give me the details, I will personally make sure that I look into this and something happens. And I will get back to you by the end of the week. And you know what? I didn't even ask her to do it. That's the worst thing. I didn't ask. She offered. But at the time I thought, wow, I think I've got her wrong. Maybe she really cares. So I gave her the particular manager's name and what had happened. And a week went by. I didn't hear anything from Teresa Cope. 2 weeks went by. Didn't hear anything. Now, bearing in mind, she said, I'll get back to you by the end of the week. So I contacted her office, asked if I could speak to her. I was told no. She was busy. I left a message. I was told she'll get back to me. She didn't. I left it for like another week or two, tried again. Nope. She just blanked me, didn't want to talk to me. I tried emailing. I wrote physical letters and posted them. Never got a response back. So at that point, I knew what kind of person she was. On top of that, there's been other instances where she's really shown her true colours. So for the same reason, I'm here. Well, no, not really. Sorry, that's a separate thing. What was it? Oh, yes, that's right. Yeah, I don't like going into this really, but for the story, I guess I'll have to. So, just after COVID, well, it was kind of at the end of COVID, it was 2020, I remember it was after the general election, actually. So what was that, September 2020? Oh my God, I should know, I stood for it. That's terrible. 2021? Anyway, whatever it was. At the time, my wife was pregnant and everything was terrible at the hospital. Oh my God, absolutely dreadful. I've never spoken about it. actually. And yeah, I'm struggling now to talk about it. But basically, she was almost full term. I think she was probably about 7 or 8 months pregnant when she got COVID herself. And, normal symptoms, cough, etc., fever. But of course, she was told to isolate at home, which was not the right thing to do. That's the first point. She was, heavily pregnant. I think it was 8 months. I remember it was towards the end. And I did a lot of research, and I spoke to other doctors in the UK who I was friends with, and they had different protocols in place in England where if the pregnant lady got COVID, they would be brought into hospital and isolated, and mother would be monitored, for like oxygen saturation and what have you. But also baby would be monitored at the same time. And if ever the baby was seen to be in distress or their heart rate dropped, and of course the pregnancy term was long enough, they would do an emergency C-section to remove the baby. And then, monitor mum as well, because what can happen, I'm trying to remember the name, but basically once the baby has been born, whether it's C-section or not, the mother's body can basically, I can't remember what they call it, go into some sort of a shock after COVID, basically, where the body doesn't really have the strength anymore to fight. And what can actually happen is sepsis. Anyway, none of that happened. That's what should have happened. She should have been put into hospital, and baby should have been monitored, and she should have been monitored. But no, they left her at home to fend for herself without any support at all. That was mistake number one. She got over COVID and things looked okay. And I'll never forget, on her actual due date, I think she was 1 day over her due date. And by this point, she was out of the COVID window. She was not classified as infectious anymore. It was like 14 days after. I think those were the parameters back then. But she was also testing negative, so, there was no COVID. And anyway, I'll never forget, it was like 2 a.m. She came downstairs and she said, "I don't feel good, something's wrong." And as she stood in front of me, her waters broke. And I knew something was wrong because I seen the waters, the fluid on the floor. We had like wooden floor so you could see. And it was brown. It should be clear. And I knew that, but I didn't say anything to her because I didn't want her to worry. But I rang up the maternity ward and I spoke to a midwife and I said, "I'm really concerned. Her waters have broke." And I remember the midwife was saying, "It's okay, that's fine, don't worry. Take your time to come to hospital. It's fine if they're just broke. No rush." And I said, "No, you don't understand." I said, "Her waters are brown." And she said, "Yeah, that's normal." And I was like, oh my God. Noble's Hospital strikes again. It's not normal. So anyway, I took her up there and they were more concerned about friggin' COVID than the welfare of the mother or the baby. It was just ridiculous. And at the time, I was actually working for the Department of Public Health. So I knew the legislation from front to back. And I was working under Henrietta at the time. who was amazing, by the way. And they locked us in a side room. They literally locked us in. And they just left us there. And I kept coming out and saying, what's happening? They're going, get back in the room, get back in the room. And I'm like, no. I said, don't speak to me like that. They're like, oh, COVID, COVID, COVID. I said, listen, we're both COVID negative. And they go, no, she was positive. I said, yeah, she was positive over 14 days ago. And she's had a clear test since then. And they just didn't have a clue. So they're like, get back in the room, get back in the room. Don't come out of the room. And they said they'll send the doctor in. The doctor came in all PPE'd up, you know. Absolute joke. And he said, I'm going to do an ultrasound. And I could see the ultrasound screen when he was doing it. And I'm looking at the screen. And he just said, okay, I'll come back and check again in like an hour. And he walked out, and I sort of, before he managed to get to the door, I said, whoa, where do you think you're going? And he said, what do you mean? I said, I'll be back in an hour and check again. I said, why? I said, I can see that ultrasound screen and there's no heartbeat. So why would there be a heartbeat in an hour? And he said, how do you know there's no heartbeat? I said, because I can see, I know how to read an ultrasound. Like, I'm not an idiot. And he was like, are you a nurse? And I went, no, but I'm not an idiot. Like, oh, honest to God. And then he went, yeah, you're right. There's no heartbeat. I said, oh, so you were just going to go and leave us in that situation and not inform us? Wonderful. Anyway, I was kicking and screaming, going nuts. And I was like, not literally, I mean like mentally, I was, you know. And I said, I want you to get Michelle Maroney down here. And they said, oh, we can't, she's not on. I said, well, who's on call? And they said, yeah, she's on call. I said, well, call her. And they didn't want to. And it took me an hour to get them to call Michelle Maroney, who's the obs-gynae consultant. Very, very good, by the way. And she eventually came down. You know, obviously she had to come from home. And she said straight away, what the hell have they done? You know, she was going nuts. She was shouting at the doctor. And she said, they should have called me sooner. And I said, listen, Michelle, I had to fight to get them just to call you. And she said, that's ridiculous. I'm on call. I said, I agree. So soon as she got there, things started getting better. And she did explain, yeah, the baby's gone. And yeah, it's hard to say. And she agreed, you know, it should never have happened. So obviously that all passed. And after some time, I decided to go to a lawyer. And the lawyer contacted Manx Care to try and get the medical records. And guess what? Manx Care wouldn't release the medical records. And the lawyer was trying and trying. He sent emails, he made phone calls to Manx Care, and they still wouldn't give the medical records. And my lawyer actually contacted me and said, Kevin, this is really unusual. But he said, I can't get hold of the medical records. They're just completely ignoring me. He said, do you think you can try and get them yourself? So I said, oh, I can try. So I did try. And it took a lot of time because they ignored me too. But eventually I went up there in person and hand-delivered a request and basically said, I want these records, you know. In the meantime, my lawyer rang Theresa Cope and basically said, listen, this is our legal position. This is what my client, me being the client, Kevin, is stating happened at Nobles Hospital. And Teresa Cope, these were the words, said Kevin is a liar. Now just think about that for a minute. I'm a patient, or, my wife was a patient, but I'm someone who has just lost a child in Nobles Hospital. And the CEO of Manx Care is calling me a liar. Now, regardless of whether she thinks I'm a liar or not, I don't care if she thinks I'm a liar, that's fine. But actually saying it from a position of CEO of a healthcare trust to a lawyer who is representing me, so that's on the record now, because it wasn't said to me, it was said to a lawyer. But imagine saying that about someone who's just lost a child. I mean, crazy, right? Anyway, nothing happened about that case because unfortunately on the Isle of Man, you don't get any support with things like that when it comes to legal costs. And we needed to get an expert report done by a legal, like a medical professional doctor who does legal reports. And just to get that report would have cost about £5,000. And of course, us paupers on the Isle of Man, just average people, can't afford that. So the likes of Manx Care gets away with it. And I just wonder how many others were in that situation where they had been damaged, left, there's many things, left in pain, left disabled, left without a loved one, down to the bad treatment or negligence of Manx Care. Makes you think. And I'm saying that because it was in the paper this week that there's currently 15 medical negligence claims ongoing towards Manx Care. And I don't believe that number. That's why I'm telling you that story, because I think it should be probably a lot more if people could face going through the process and if they had the money to go through the process. But the reason I'm telling you that story is also to let you know about Teresa Cope's character and whether or not she was fit in the first place to retain a position in a health service. You think about that, a health service who are supposed to be there to help and support and care for the sick and the vulnerable. And yet, that's her behavior. So not only did she wrong me with my complaint as an ex-employee, and completely ignored me, didn't get back to me. And by the way, I was a union rep at the time too. So it doesn't look good, does it? But also, she, when we were at our lowest after the death of our child, I'm being called a liar. And again, that's to my lawyer, not to me. So, and my lawyer actually said to me, his words were, God, she must really hate you. What have you done to her? And I told him the truth. I said, the only thing I've done is, like many people on the Isle of Man, I've spoke out against the bad health service. I've spoke out about her publicly. And of course, she's not going to like that. But she has to remember that she has put herself in a position of being CEO. And with that position, comes criticism, especially if you do a bad job. The worst part was, when I first met with Teresa Cope, I was very open to her changing my mind about her. In fact, I was open to working with her. That would have been the greatest outcome. You know, because I'd also told Teresa Cope that I had seen that they were advertising for I think it was a non-executive board member or something, like a lay member on the Manx Care board. And I told her that I was thinking about applying for that. And because I felt like I could put a lot of input into the board, but I know now it would have been a waste of my time. They would never have listened to me. They obviously had their own agenda, and they're not going to listen to someone, no matter who they are. They're not going to listen to anyone else's ideas or input. For whatever reason, they decided to go their own way on many decisions for Manx Care and Nobles Hospital. I think if there was an investigation done into some of those decisions, you would find a lot of dodgy things going on. I mean, that private company that was brought over to shorten the waiting lists, I can't remember the name of the company off the top of my head, but a lot of money went to them. Now you have to ask yourself, what was the connection between Teresa Cope and that company? Was there any personal connection? I'm not saying there is, but you have to ask the question, right? You know, I'm doubting a lot of things now when it comes to her. And I'm even surprised at myself, because I never would have gone that far in the past. I would have just said, I don't think she's very good at her job. But now I am genuinely starting to believe there's other things, maybe more underhand, that went on. But on top of that, we've now seen the chair of Manx Care. I think her name is Wendy Reid. Now, I can't say anything about her because I don't know her. Never spoke to her as far as I remember. Never met her as far as I remember. Don't know anything about her. So I can't sit here and say anything bad about her at all. Equally, I can't say anything good about her. But the only thing I can say is, you know, she's openly admitted recently in the press that, you know, she came on board to work with Teresa Cope. And it sounds to me like they obviously worked very closely. And as chair, she would have agreed with a lot of the decisions that Manx Care put out and that Teresa Cope put forward. So in that regard, I'm also glad that the chair has stepped down, because, well, you only need to look at results from Manx Care to know that they haven't done a good job. It's the results that count at the end of the day. You know, in the private sector, if you don't produce results, you get sacked. You know, you don't get kept on for 5 years and be let to just keep making mistakes. It's ridiculous. So I think we're going to see a domino effect now. I think a lot of the persons that were involved in making all of these bad decisions with Teresa Cope are going to start jumping ship. And so they should, quite rightly. I can see where this could go in a positive way. We could really take advantage of this as like a clean slate now to get right people in the right places in Manx Care. But we really do need a clean slate. I think the whole board needs to go. We need the board completely to be disbanded. And we need some really good people in there. I could genuinely write a list of people that need to go. Teresa Cope actually isn't the only one that has made problems. But she's CEO, so she heads it, right? But there's people underneath her that also need to go. And I just hope that we can get back on track to a brighter future with Manx Care for the island. It's possible. It's so easily done. Actually, it really is so easy to do. But we keep getting the wrong people who just only care about themselves and have no knowledge and no experience, and they don't give a damn about the Isle of Man. Like I said, they've got no skin in the game. They come over from wherever, England or another country, and it's just a job to them, and they need people who love the Isle of Man and who want to see the Isle of Man be the best for the people. So I'm keeping a close eye on this. You never know. I might put my name forward for a position, because I've already been working in very high positions throughout Asia for the last 2 years. So let's just say I've gained a lot of experience to potentially apply for a certain role. But we'll see. It's exciting, but I would like to see... No, scrap that. I'm going to do what Teresa Cope never could. The line manager that I mentioned, the bully, that's another one that'll be going soon. And I'm going to make sure of it. So if you're in Manx Care working and you've got a guilty conscience and you've mistreated people and you've bullied people, start clearing your desk. People are coming for you. I'm coming for you. Because this is for the Isle of Man people. This is not for me. This is not for anyone. I've got nothing to gain. The only thing I want to see is the Isle of Man have a good, effective health service for people who live on the Isle of Man. And I'll do whatever it takes to make it happen. I'm not scared of having a bad name or upsetting people, because the people that are upset, if you're upset with anything I've said, you need to ask yourself why. And what position are you in? Because if you're in the right position, you're doing the right things, you should be on my side. Because that should be your goal too. For the Isle of Man to have the best health service for the people of the Isle of Man. So, let's see who else goes. I think there's going to be someone else within the next week. I'm excited. This video's gone for a little bit longer than I thought, and it got a little bit emotional in the middle as well, I'm not going to lie. But, what can I say? I'm happy that these people are going. So, let's do the right thing. Let's work together to improve the health service of the Isle of Man. I'm lucky to be in a position where I still have a lot of relationships with doctors and nurses that work in the hospital, and I always have done. I get a lot of healthcare professionals, including GPs, contacting me all the time and telling me what has happened, what's gone on. And actually, I remember in the meeting with Teresa Cope, she really wanted to know the name of a GP that told me something. And I wouldn't give it to her. And she was like, oh, it'll be kept confidential. I said, no. When people tell me something in confidence, it stays with me. I don't share people's names. And I'll just say one other thing before I end the video. Years ago, I got threatened to reveal a source by, I'm trying to be careful what I say now, by somebody in Tynwald, by a certain MHK. It wasn't in this house, it was in the last house. But they were really pushing me on revealing this name. And I said, no, I won't ever go against, you know, I will never break someone's confidence. Never, no matter what. And this particular MHK threatened me. And they said, well, you'll be made to come before Tynwald Committee and reveal that name, and I can make you. I can, what's the word? Like have a court order, basically. And I said, and I remember looking in their eyes and saying, go ahead, make yourself look stupid. Get the court order, bring me into Tynwald Committee, ask me the question again on the record, and then be made to look like a fool when I tell you no. And guess what? They never got the court order. They never brought me before the Tynwald Committee because I don't care. That's the difference. I don't care. You know, I don't care about their silly rules. I don't care about being politically correct, or like, I don't have to stand for an election. I don't have voters to please. You know, I only care about doing the right thing for the people of the Isle of Man. I'm not doing it for any reason. That's the point. I'm not doing it for reward or any kind of personal gain. But these people in the wrong positions have something to gain. They have to keep certain people pleased. Otherwise, they'll lose their money, they'll lose their position, they'll lose their, you know, the gravy train or whatever. So, yeah, interesting. So, anyway, we'll keep an eye on this. And sorry the video was so long. Cheers.